guys and welcome to my channel. Today's topic is acne and types of acne. So now we start with the grade 1 of acne, that is just plain comedons. Now what are comedons? Comedons are whiteheads and blackheads. You remove one blackhead, the second one pops out within a few days. Why? The pores in which your keratin is present, it comes out, and when it comes on the surface of your skin, it gets oxidized and converts into a blackhead. If it doesn't come on the surface of your skin, it remains inside your pore. That's when it becomes a whitehead. So it is not dirt, but it is actually your keratin. Keratin is a protein structure of your skin, of your epidermis. So what you're doing with the blackhead extractor is that you're just pulling out your epidermal layer, which is actually wrong, because even though it comes out, it will recur again and again. Do that a lot of times, you might just result into scarring. In fact, you can use retinoids for blackheads, which is a very helpful method to get rid of those blackheads and whiteheads. But the side effect of retinoids is that it causes a lot of photosensitivity, so you need to take care in what proportion you are using. Now in comedonal acne, that was the first type of acne, there was no major bacterial infection or bacteria involved. But in the second type of acne, which is the inflammatory acne, there is bacterial involvement. The bacteria, as we spoke about in the last video, is Propionibacterium acnes, which is the bacteria causing acne almost 80% of the times. And this bacteria is normally present on your epidermal layer, which gives it easy access for your epidermis and which causes you to break out. I've seen for a fact that a lot of YouTubers or a lot of people have spoken about clindamycin. A lot of you believe that clindamycin works on inflammatory acne. It used to work on acne, but nowadays it doesn't. In most of the people, almost in 70 to 80% of the people, clindamycin doesn't work on inflammatory acne. Now what is clindamycin? Clindamycin is an antibiotic which helps you to actually kill the bacteria. Now these bacteria, which is the Propionibacterium, it has developed resistance to this clindamycin because everyone has used it rationally left and right without knowing for what it is used. It might work in the initial time because that time your skin is sensitive. But if you use it left and right and you don't know how to use it, please don't use it, because it causes resistance, and because of that, resistance has developed to clindamycin, and now it is one of the most completely useless topical application. So please, before taking any antibiotic, please think that you might just become resistant to the antibiotic, and in the future, if you actually need that antibiotic, your body might just not respond to it. We give combinations, we don't give clindamycin alone. All these antibiotics are used in combinations because they have their permutations and combinations. You cannot just use any antibiotic with any antibiotic. So skincare should be tailor-made for each and every one, because each and every person has their own set of skin problems. And secondly, you need to apply it very carefully under the supervision of your dermatologist, because if not, it might give you side effects that might sometimes be irreparable. So the next type of acne is pustular acne. Now here probably your acne is infected with bacteria, so please don't try anything at home. Don't apply any kind of homemade DIY haldi, besan, anything. Please don't, because it's bacteria. You might probably just worsen your acne and worsen your pus. So just remember that. Secondly, don't apply any acids, active acids to your face without consulting a doctor, because mostly we don't give acids to apply directly on the face. First, there is a complete and regime of oral medications. We might probably shift you to topical medicines, but then here try and avoid any kind of topical acid application. AHAs, BHAs, retinols, don't play with your skin at this point of time, because this is where it starts getting worse. Pustules and everything, they combine together, they become one big cyst, and there might be even a sinus formation in it, and the scene is really very bad. The next type of acne is the nodular cystic acne. Now this is where it is really bad. It's really painful. Nodular cystic acne, it becomes big. It is mostly because of your hormonal outburst, mostly happens in your teens, or if you don't take care of your pustular acne, and if you keep on ignoring it, it might just turn into a nodulocystic acne. And remember, nodulocystic acne is really painful, and it leaves really bad scarring on your face, which is permanent. And trust me, those scars to get rid of is the most difficult thing. So please don't pick these nodulocystic acne, as they will leave really bad scars on your face. Nodulocystic acne requires a longer period of treatment, maybe 6 months, maybe a year or so. So you need to be very patient. So don't expect very fast results, and don't apply anything that's made at your home. It's the further step of nodulocystic acne, where your nodulocystic acne worsens even further, and there are literally sinuses draining from your acne. So yeah, this is the kind 5 of acne, and this is the most acne conglobata. Severe form of acne. It's very painful, your skin becomes red, and it has discharging sinuses on the surface. So yeah, we will put you mostly on heavier antibiotics, topical antibiotics, also anti-inflammatory products, and also antibacterial products topically.